Interestingly, for the follicular lymphoma cohort, it's actually a little bit better. And even so much so that it potentially raises the question of whether this could be dosed outpatient. So for follicular lymphoma, about 23% of patients had no cytokine release syndrome whatsoever. And those that did, their onset, the median onset, time to onset was 4 days, as opposed to 2 days with Axi-Cel in large cell lymphoma, so slower onset. And then in terms of reaching high-grade cytokine release syndrome, only 7% of patients had high-grade cytokine release syndrome. And similarly with neurologic toxicity, only 15% had high-grade neurologic toxicity. So both of those numbers are about half of what we tend to think of with Axi-Cel and large cell lymphoma. The marginal zone lymphoma cohort had a slightly higher incidence of cytokine release syndrome, as well as higher grade neurologic toxicity, more like what we see with diffuse large B-cell lymphoma, although similarly, the median time to onset was late at about 4 days. So same degree of toxicity, just occurring later than what we're used to seeing.